people, this is Dr. Muskaan this side, and today I'm going to discuss one very beautiful case. This was the most interesting case I have ever seen. It was all about acute toxic goitre with atrial fibrillation. Here is 35-year-old male who has came to OPD with chief complaints of fever, shortness of breath and cough with sputum since morning. So when chief complaints comes, we have to think of differentials. So what are the differentials for shortness of breath? FMT, if I am thinking about heart, it can be heart failure, it can be MI, it can be cardiac tamponade. Okay, if I am thinking about lungs, your mnemonic is P3, A3, P3 is pneumonia, pneumothorax and pleural effusion. A3 is asthma, anaphylaxis and allergy, and C is your COPD. Next is your chief complaint was cough with sputum. If I am thinking about cough, your mnemonic is A3, C3, PMSG. Okay, A3 is your allergic bronchitis, allergic rhinitis, asthma. C3 is your COPD. Other is CHF. Other is common cold. PMS. S is sinusitis, M is malignancy, P is pneumonia, and G is GRD. Okay, so you have to mark it up, all these mnemonics, all these differentials, because it will make your case study interesting. Okay, now next is cough. Okay, cough is done. Sputum. Sputum, we see the color. If it is red in color, it is your pneumococcal pneumonia. If it is green in color, it is your long-standing infection such as pneumonia. It can be your cystic fibrosis. It can be lung abscess. Okay, it can be bronchiectasis. If it is white in color, it is asthma, COPD and chronic bronchitis. If it is pink in color, the differentials is acute pulmonary edema and alveolar cell carcinoma. If it is yellow in color, it is asthma and acute bronchopulmonary infection. Next, chief complaint was fever. So fever, if the patient is having toxic look, the mnemonic, the differential is typhoid. It can be septicemia. If it is myalgia, severe myalgia के साथ fever है, the differentials will be leptospirosis, influenza, okay, and other is chikungunya. If it is with marked perspiration, the differentials will be rheumatic fever, amoebic liver abscess, brucellosis and septicemia. If it is with convulsions, the differentials will be your CNS problems such as your cerebral abscess, meningitis, tuberculoma. If it is with lymphadenopathy, the differentials will be tuberculosis, lymphoma, secondary syphilis, SLE and AIDS. Okay. Now, HOPI. Patient was apparently alright 2 days back when he developed fever which was high grade, on and off in nature, not associated with chills, relieved on taking medications. He also developed cough associated with white sputum. ठीक है, white sputum के साथ हमने कौन से differentials पढ़े थे? COPD, chronic bronchitis and asthma. Okay, it was scanty in color. It was also associated with shortness of breath, which was sudden on onset, and he was not able to dress or undress by himself. That is MMRC grade was 4. Negative history in this patient is chest pain, palpitations, pain in abdomen, burning induration, pedal edema, excessive sweating and weight loss. Okay, so we have ruled out heart disease, tuberculosis, GIT. जो अपने डिफरेंशियल स्वेटिंग वाले सोचे थे टॉक फीवर के साथ, कौन से सोचे थे? सेप्टिसीमिया, रूमेटिक हार्ट फीवर, अमीबिक लिवर एब्सेस, ब्रुसेलोसिस, वो सब कैंसिल हो गए. HOPI हो गया. ठीक है. नाउ पास्ट नेगेटिव हिस्ट्री हो गया. पास्ट हिस्ट्री देयर वाज प्रेजेंस ऑफ सिमिलर कंप्लेंट्स इन द पास्ट. There is no history of surgery in the past. There is no history of tuberculosis or TB contact, type 2 diabetes mellitus or hypertension or any other comorbidities except hypothyroidism from last 2 years. Okay. Personal history: patient takes non-vegetarian diet. His bowel habits are abnormal. He is having loose stools. He is chronic smoker since 20 years and left smoking 2 years back. He has a history of tobacco consumption since 15 years. There is no addiction to alcohol and sleep habits are normal. On general examination, blood pressure was 116/60. There was low diastolic blood pressure, so we calculated pulse pressure. 116 minus 60, that comes out 56. Pulse pressure, if it is more than 40, it is widened pulse pressure. Okay. Pulse rate is shows tachycardia, respiratory rate shows mild tachypnea, and fever was febrile. Okay. It was 101 degree Fahrenheit. So what are the causes of wide pulse pressure? If it is physiological causes, it is your advanced age, arteriosclerosis, pregnancy and well conditioned athletes. If it is your pathological causes, it is your AR, AS, IDA, thyrotoxic thyrotoxicosis, beriberi, obesity, cirrhosis, ठीक है, paid inductive arteriosus. Now systemic examination was done. In systemic examination, thyroid gland was enlarged, movable and painless. Pain only occurs when he swallows something. Cardiac system examination, there was tachycardia present, atrial fibrillation present, there was widened pulse pressure present. On nervous system examination, there was presence of irritability, fine tremors, muscle wasting, sweating and hyperthermia, little bit sweating. Okay. Thyroid function test shows increased T3, T4 levels and decreased TSH. CBC report shows anemia. KFT report shows increase in blood urine nitrogen. Liver report shows serum transaminitis. ABG picture shows metabolic acidosis. ECG shows irregular RR interval, no P wave, that diagnosed as AF, atrial fibrillation. What are the causes of atrial fibrillation? There can be cardiomyopathy, which can be dilated or hypertrophic. There can be thyrotoxicosis. It can be because of the ABG, which is not good. It can be because of MI. It can be because of ischemic heart disease. It can be because of MSMR. It can be because of electrolyte disturbances such as hypokalemia or hypomagnesemia or pheocytochroma. Okay, so my probable diagnosis here is acute toxic goiter, that is thyrotoxicosis with AF. Management given to this patient was tablet augmentin. To treat the bacterial infection, augmentin tablet contains amoxicillin and clavulanic acid. Injection Pantof was given to treat GRD. Tablet digoxin was given, which was helping in controlling the ventricular rate in AF. Tablet lesitoclone was given to increase the urine flow. Syrup glycinidus was given to treat the cough. Tablet Ciplar LA was given to relieve the symptoms of anxiety. Tablet neomercazole was given to reduce the formation of thyroid hormones in people with an overactive thyroid gland. So I hope you have also enjoyed listening to this case. This was my favorite case which I have shared with you. So that's all. Bye bye people. Dr. Muskaan is signing off now.